Pyelonephritis is a bacterial infection of the kidneys. It can be very serious. The kidneys are a very important function to the body, and it can cause an infection to enter in the bloodstream. If a woman is pregnant and cause her to go into premature labor, kidney infections mostly happen in women more than they happen in men. Most kidney infections are from a lower urinary tract infection or usually a bladder infection. Bacteria can travel from the vagina or the rectal area into the urethra and the bladder. The urethra is the short tube that travels and carries the bladder or the urine in the bladder. A woman's urethra is very short. It's about 2 inches long. It's just above the vagina. Because of the location of where it is, women are more likely to have bladder infections. In men, the urethra extends the full length of the penis. Infections of the lower urinary tract in men also occur with a prostate infection. The lower urinary system infections may spread to the kidneys, and that's what causes pyelonephritis. If you have a bladder infection, it's harder for your body to stop the urine from flowing back into the kidneys. And this problem can allow for infected urine to move into the kidneys and to flood the kidneys. The urinary system is a common place for birth defects. If your urinary system is not normal, you have a greater risk that a bladder infection can spread to the kidneys. Or if you have any blockage from a kidney stone, you're also at risk for developing pyelonephritis. The symptoms for pyelonephritis can be either mild or severe. They include chills, fever, sweat, abdominal or back pain. If there's a loss of appetite, you feel nauseous or vomiting, any problems with urination. It's sometimes hard to determine if the urinary systems are an infection of the lower urinary tract infection or of a kidney infection. None of these symptoms should go ignored. You should go see your doctor right away if you do have any of these symptoms. A bladder infection can rapidly become pyelonephritis and cause an infection to go into the bloodstream. Do not let these symptoms continue. You need to go to the doctor if you have any of these symptoms. Your doctor will look through your medical history and look to see if you have any other past recent urinary tract infections. The doctor will give you a physical test. They'll check to see if there's any pain in the kidney area. They might test a sample of your urine in the lab. Usually, the doctor will give you antibiotic medicine for the kidney infection. First, you might be treated as an outpatient. You may continue to be treated if your symptoms appear to be getting better 24 hours after you start taking the medicine. If you are really seriously ill, or if you're dehydrated, or if the medicine isn't working for you, you may need to stay in the hospital. There you will be given any fluids and medicines inside of the IV. Typically, the antibiotic is taken for at least 7 days. You need to make sure that all of the bacteria is killed to prevent any kidney damage from being caused or to prevent the infection from coming back. After the first day or two of treatment, depending on your lab test, your antibiotic may need to be changed. Your doctor will let you know if this is the case for you. It depends how severe your symptoms are for how long it's going to take you to recover. If you have a mild case, within the first 1 or 2 days, you start feeling better, but some severe infections take at least a few days to feel better. If you have the proper treatment, there's few complications of pyelonephritis. However, if your symptoms appear after you finish your treatment, you may need more tests. Your doctor may need to check to see if there's an underlying cause or if it can be caused by like a kidney stone or something. You need to make sure you notice if your symptoms become better after you start taking the antibiotic. Make sure you drink a lot of fluids. Follow the doctor's instructions on how to take the medication. Even if you do feel better, continue to take all the medicine until it's gone. Most pyelonephritis cases happen in women, result from a bladder infection. You should prevent bladder infections to help prevent kidney infections. Make sure you drink a lot of water, non-caffeinated drinks. You want to make sure that you practice good hygiene when you use the toilet. Example, wipe from the back to the front, or I'm sorry, from the front to the back. Don't use any annoying, irritating cosmetics in the area of the vagina, such as, strong soaps, scented napkins. After you have sexual intercourse, you want to make sure that you urinate to empty your bladder to help prevent pyelonephritis from happening in bladder infections. If for a man, there's really no specific prevention that they can take. Just practice good, gentle hygiene. General hygiene. If you're a man and not circumcised, you need to pull back the foreskin to wash the tip of the penis every time you shower.